Hello, everyone. I'm Kim Douglas, and welcome to Your Healthy Dose. It's a podcast about current trends in healthcare. On today's episode, we're going to talk about bladder cancer, but this isn't just any ordinary episode because it's the first time that we get to hear from both the patient and their doctor at the same time. Our first guest is Lee Smith, who is a recent bladder cancer survivor. Congratulations.
Thank you.
And next to him is one of the doctors who saved his life, Dr. Jennifer Linehan. You are a board-certified urologist and an associate professor of urology at Urologic Oncology at St. John's Cancer Institute. Welcome to you both. We're so glad that you're here today. And you know, this is a topic that we really don't hear that much about. So Dr. Linehan, do we know what causes bladder cancer, and is there anything that we can do to try to prevent it?
Yeah, there are some causes of bladder cancer that we know of. The first one is definitely smoking, aniline dyes, sometimes like paint thinners, if you have people that work with all those kind of things, any kind of chemicals, as well as sometimes overuse of narcotics. And then there's some Chinese herbs called aristocroic acid that are also known to cause bladder cancer. But of all these things, you know, Lee did not do any of these things. We live in a very healthy community in Santa Monica, and I will still see patients that come in with bladder cancer, and there is some genetic disposition. We don't completely understand that yet. I think that's on the forefront, but I know it was really frustrating for Lee looking for the answers of, you know, why would this happen to me?
Right.
So when I got the news that I had cancer, I went through, a period of like a week or two where it was, why me? And it was really depressing. And the fact that there was no apparent cause was frustrating. There was nothing I could point to. There was nothing I could say, gee, this is where I messed up and this is why I have this problem. It was more sort of like, getting hit by a bolt of lightning on a clear day. And fortunately, that didn't last for a long time. It was sort of like a week or two. And then I sort of got to a place of, well, why not me? Like, bad things happen to people all the time. I'm fortunate I got to the age of 56 without having something like this happen. And let's start moving on instead of sitting around feeling sorry for yourself. But definitely the ambiguity of why this was happening contributed to that sort of feeling of depression and, woe is me.
Yeah, and you didn't do anything wrong, you feel. So I totally relate to that. What were the events that led to your diagnosis, and did you have any symptoms?
So originally I thought I had a problem with my prostate. I was having difficulty urinating. I'd had an elevated PSA. So I sought treatment from a urologist affiliated with a different Westside hospital and sort of pursued that path for about 6 months. I did feel better. And then I had an executive physical, and I got a clean bill of health with one exception, which was that there was an anomalous blood result related to kidney function. So I pursued that shortly thereafter with my general practitioner, whose name is Dr. Jill Way. She's with St. John's Physician Partners. And over the course of a couple of weeks, that blood test kept getting worse and worse. And it was a real head scratcher. It was like, what's going on? So at Dr. Way's insistence, I went in on a Saturday to the emergency room at St. John's, and I had an ultrasound of my kidneys because we thought there was a problem with my kidneys. And while I was there, they also looked at my bladder. And the nurse came back and said, well, your kidneys are fine, but there's a large mass in your bladder. And part of that experience that I'll always remember is that she then said, good luck to you.
Oh, goodness.
And that was sort of the first clue that, we were not in Kansas anymore, Toto.
Yeah.
So on Monday, that was on a Saturday. On Monday, I talked to Dr. Way. She referred me to Dr. Linehan. Dr. Linehan and I had our first phone conversation on Wednesday. I went in for pre-op and met Dr. Linehan in person for the first time on Friday. And then the next Monday, which was only 10 days after my ultrasound, I had surgery to remove the tumor.
That was fast.
So in the medical world, that was like lightning fast.
Yes, absolutely. So in full disclosure, we know each other's families, and we actually started way back in preschool. I know your family, and I know how close you are. So you shared with us that one of the hardest things was sharing this news with your family. Tell us a little bit about that.
Yeah, so I had the surgery on Monday, and they then biopsied the tumor. And on Wednesday, Dr. Linehan called and said, this is muscle invasive bladder cancer. And the standard course of treatment is to have 3 months of chemo followed by surgery to remove your bladder and your prostate. My head was sort of swirling with that information. But that day I talked to each of my 4 boys and my wife, and cancer has the word has a real stigma to it. For one thing, it's really easy to sort of catastrophize when you hear that word. People, think you're gonna like drop dead like that moment right away. I'm sure you experienced a lot of this in your journey, and I was just used to being the provider, the source of stability, and I really had to start leaning on my family for support and help, particularly, the 3 months of chemo were not the worst in the world, but it was rough. And then, Dr. Linehan was always very honest with me that the first 3 months after surgery were, in her words, brutal.
Yeah.
And she was right. It was brutal. And having that love and support. My 2 sons who lived in San Francisco immediately moved home, which they could do because it was during COVID and they could work remotely. But it was a big shift in the dynamics of our family.
Yeah, it's such an active family, and you guys always doing stuff. So, Dr. Linehan, how do you prepare your patients like Lee once they have been diagnosed with cancer?
So it depends on what type of bladder cancer. So there are bladder cancers that are not going through the muscle wall of the bladder. There's 3 layers of the bladder. Some are very superficial, and you can actually put chemotherapy inside the bladder to treat some of those. For Lee, because it was going into the muscle wall of the bladder, that changes the prognosis. Okay, so we know at that moment there's a high chance, there's a 30% chance that when Lee walked in the door, he already had metastasis to the lymph nodes. We may not see it on the CAT scan, but it's micrometastasis. So that's what the chemotherapy is actually for, to kind of catch all that stuff before you take out the bladder.
Interesting. So not all bladder cancers, you're saying, has to have the bladder removed?
Not all bladder cancers have to have the bladder removed, only if they're muscle invasive like that. And even the patients who are muscle invasive, you can do what we call a bladder sparing protocol, which is where you give chemotherapy and radiation to the bladder at the same time. The problem with that is that Lee is very young, and that has a much higher chance of recurrence. And when you try to take out a bladder after radiation, there can be other difficulties with that. So we really felt that for Lee, because he had another 50 years of life left, that we're going to get there. Chemotherapy and removing the bladder was the best.
It's the best, great. And what options does the patient have if it is removed?
So if we need to remove the bladder, there are 3 different options you can offer the patient to do the reconstruction of the bladder. I always tell people that this is one of the most complicated surgeries, even more so than like a heart surgery, because with a heart surgery, if there's a blocked vessel, they open the vessel, they reconstruct the vessel, but relatively the anatomy is still the same. I am physiologically changing his entire body by taking his bowel, which has done a very different job his entire life, and making it into a container that holds urine. I mean, the bowel's job in a sense is to absorb nutrients, right? But now in Lee, it's going to hold urine, and I actually don't want it to absorb anything. I just want it to hold the urine and then empty the urine. So you can offer patients 3 different options depending on age, depending on sort of their mobility, actually, and what their kidney function is. One thing you can do, which I always call the Toyota Camry of bladders, is you can do something called an ileoconduit. It'll run forever. The surgery times are shorter. It doesn't take a lot of maintenance. And basically you drain urine through the bowel into a bag on your abdomen. So your kidneys are hooked up to the little piece of bowel. There's a little stoma on your skin, and you put a little ostomy bag around it, and then they empty the bag. And then the second option is what Lee had, which I call the Porsche of bladders. It's a lot more maintenance. It's a longer surgery. He may need to actually do some of the maintenance himself at home, lifelong. And this is where you take the bowel, you actually make it into a bag, and then hook it back up to his urethra, or the pee channel. So it's almost like his normal bladder, although he doesn't have the same sensation of urination. It's probably more like a fullness now, correct?
Yes.
And then the third, it's something called an Indiana pouch, which I call the Lamborghini of bladders because it takes so much maintenance. And that's actually where you have a little opening on your belly. It's very small. And the patients actually catheterize with a tube into their own belly to remove the urine every 4 to 6 hours. And all those things are done for various reasons. But yes, it's one of the really rare surgeries that we do, more like transplant, where we are physiologically changing their body.
Literally, that is. So how long was Lee's surgery?
Surgery was at 8 hours?
12
hours.
12 hours. And is that normal for you? Would that be a normal?
Yeah, because usually I work in combination with Dr. Wilson, who's my partner, and he will usually take out the bladder, but then he has to do all of the lymph nodes in the pelvis, sometimes almost up to the kidney, because for bladder cancer, the more nodes you get out, the better the patients do. So he does that portion of the surgery, and then I will usually come in and do the reconstruction. And with the reconstruction, there's a lot of little steps because you have to take apart the bowel, like harvest the bowel, put it back together, make sure that's fine, and then hook up the kidneys.
So how long were you in the hospital, and you were in during COVID? How was that?
Mm-hmm. Dr. Linehan was right. It was brutal. I was in the hospital 3 separate times for about a total of 3 weeks. The first time to recover from the surgery, then I had to go back a second time, courtesy of the LA Fire Department, because I couldn't get out of bed because I had a partially obstructed bowel. And then I had to go back a third time because I had a completely obstructed bowel, and I had to have emergency surgery with Dr. Linehan and Dr. Bilchek to resolve the obstruction. And to answer the second part of your question, so this was in February of 2001, and it was really the height of COVID. There was an entire floor at St. John's devoted to COVID patients. No visitors were allowed, and it was both lonely because, there were days where I couldn't even scratch my nose. And although the nurses were fantastic and did a great job taking care of me, they had, as you would expect, other patients to take care of. So they weren't always there. And it just was, it was just rough being alone when I was really not doing very well. And also just sort of the fear of, that I was still relatively early in COVID. It was before the vaccine. And it's, the last thing in the world I need to do is, on top of all my other problems, get COVID. So it was a scary time.
Very, and thank goodness for your strength. You must be a very strong man. Now let's touch on the topic of your relationship with Dr. Linehan and the other team members at St. John's, the other doctors, surgeons, so
Sure.
on.
So, as we talked about, Dr. Linehan and I both have roots in Northern Ohio.
Right.
And there are some aspects of growing up there that, breed sort of what I would call grim determination, and also sort of sarcastic humor. So we connect on that
Both
level.
of those, yeah.
So every week I was all of a sudden meeting with a different St. John's doctor, whether it was Dr. Linehan And then I met Dr. Todowski, which was the oncologist who led my chemotherapy, Dr. Wilson, who participated in the surgery, Dr. Way, who was my general practitioner, Dr. Tadwalker, who cleared me for surgery. He's a cardiologist. And then, Dr. Bilchek, who did the emergency surgery on my twisted intestines. So it just was, again, feeling like everyone was on the same page and that everyone was coordinating with the other doctors. So, for instance, when I went to meet with Dr. Tadwalker, I didn't have to spend half an hour telling him, here's my story. And it's a long, complicated story. He already knew. And that just made it, again, so much easier for me as a patient. And it was a lot more efficient because those, as you know, those appointments take up a lot of time. And I had other things to do, hopefully. And, just, again, developing that feeling of trust. Like, this organization really wants what's best for me. And they're working really hard to make sure that happens. And that was, during a pretty dark time, that was a real positive.
Yeah, I think, when we see patients, we write a note in the chart, right? But when you call another doctor, when you talk to another doctor, Dr. Tadwalker, we're going to do this surgery. Here's what's going to be involved. Here's what I need to know. It's a quick understanding, and it really helps them focus on what they need to do for the patients. And the unique thing about St. John's is that all of us, like Dr. Tadwalker, Dr. Todowski, Wilson, Dr. Way, we're actually more than just colleagues. We're also friends.
Yeah.
We're a very close-knit group, and we constantly communicate with each other. And so I would basically send out message blasts about Lee to everyone or call them very easily and say, this is what I need, this is what we need to take care of. And that obviously shortens the length of care because things are going to get done much, much faster. It's not like, okay, well, go call Dr. Tadwalker's office and wait 2 weeks for your cardiology appointment. No, I need you to see him like tomorrow because we're going to be doing surgery next week. So I think that's the important, part of all of us working together.
That is very important. And you're so right. It's priceless. And also when you were talking, Lee, about just repeating your story, I know when I was going through mine, you're weak anyway, and you're scared and you're hurt. And then the energy it takes to tell 10 doctors the same story. So this
Right.
is amazing at St. John's to have that camaraderie.
Right.
So let's go into the future now. How does it look for bladder cancer, and what types of innovations are being made? And are there any promising clinical trials?
There are definitely more and more promising clinical trials for patients like Lee, especially with the muscle-invasive bladder cancer, because those are the patients that, will suffer the most and have the most, chance of recurrence and death, et cetera. So first of all, again, going back to early detection, there's now 7 bladder cancer tests on the market. A lot of them I was involved in some of the initial research, getting those. Those are urine tests, essentially. We now have newer blood testing that will actually find snippets of DNA in their blood, DNA specifically from the cancer. Now, what this will tell us ahead of time is, are these patients going to be susceptible to chemotherapy? Do they need chemotherapy? Are they going to be should they be going right to surgery, or should they have immunotherapy? Wow. And that is a very easy, it's almost like a liquid biopsy test now that we have, that Lee actually wasn't around that much even when you had your cancer. And we're starting to do a lot of initial investigation with that as well. And the drugs, as far as that are coming onto the market for invasive bladder cancer, for example, if Lee were to recur or anything else were to happen, there's like a slew of clinical trials that are now ongoing with a group called SWOG. So that would give him, 5 or 10 different options if needed. So I think that is a really important step for bladder cancer. And I've been lucky enough to be a participant in a lot of what we call bladder cancer think tanks, where they get all the investigators from across the country. They stick us in a room and say, talk to each other, figure out what you all are doing, and then work together. Because if someone's doing something at another hospital, how do you know?
Yeah.
And then we're doing the same thing. And if you start putting stuff together, research gets done way faster for the patients. So I think those are some things that I really appreciate about being at St. John's, being part of the Cancer Center, and working with patients like Lee.
Well, Lee, so how is the recovery process going? And I hear, rumor has it, that you recently retired, and we want to know, how are you spending your free time besides bringing flowers every day to the doctor at St. John's?
Exactly.
It's more like Pop-Tarts.
Oh, we like Pop-Tarts. Oh,
Yes,
good.
we share an affinity for Pop-Tarts.
Oh, you too.
So it's been a gradual process. The period immediately following the surgery, I had 3 infections. I lost 45 pounds at one point, in addition to the emergency surgery that we already talked about. I mean, the first 3 months were really rough, and then it just sort of slowly got better. I was able to get out of bed. I was able to start walking around. One day, my family made the mistake of leaving me at home by myself, and so I broke out of the house and with a walker walked a block down the street. I was really happy I didn't fall over, and just things got progressively better. I've had to learn to adapt to the new bladder. It doesn't work like the old one did, so that's been a process, and just getting my strength back, and went back to work for about a year. And in March of this year, I retired, and retirement is great. I mean, honestly, if I'd known retirement was this good, I never would have started working
In the first place.
But I sleep better, I eat better, not as many Pop-Tarts, and I get some form of exercise every day. I get to spend a lot more time with my wife. We have, breakfast or lunch together a couple times a week, and we've done a little bit of traveling. I'm a little leery of leaving the country, but within the 50 states, we've done a bunch of traveling just to visit family and visit kids, and I just physically feel so much better. I mean, the biggest change is I have maybe 5% of the stress that I had when I was working. So all good.
You look like the picture of health. You really do. You look
Thank
great.
you.
Now, Dr. Linehan, I've heard that you like to do more than just give your heart and soul to your patients. And you also give back to the community, not just here at St. John's. Can you tell me about how you like to serve underprivileged families and children?
Yes, so I get the very distinct honor of seeing patients in the Venice Family Clinic pro bono. So they can come over and see me. They have access to my clinic. And actually, St. John's is incredibly supportive of this. They will help provide, imaging for those patients, testing for those patients, anything that they need. And of course, the care is all free and my care is all free. Oftentimes those patients would never have access to this kind of care if we didn't open the doors for them. They don't even know sometimes who to ask for, what to ask for, or what they need. Some of them have had bladder cancer, prostate cancer, all sorts of things that had, they gone somewhere else or not had insurance, would have been, undiagnosed for years.
For sure. Wow. Well, you really are a very special person. And in closing, I just wanted to see if both of you had any last minute thoughts or any pieces of advice or inspiration that you can give to our viewers and our listeners. Let's start with you, Lee.
Sure. These are sort of trite and sound like cliches, but if you're facing a problem like what I did, the first thing is to get the best doctor you can. And I was really lucky because I got the best doctor.
You did.
The second thing is just do what they tell you to do, right? Show up when you're supposed to be there, follow the instructions. And then third, just, take it one step at a time. Winston Churchill once said that if you find yourself in the middle of hell, keep going. Mm-hmm. And that's what it was like, just trying to get through today, hoping that tomorrow is going to be better, even though there were a lot of days where tomorrow wasn't better, it was actually worse. But over time, it does get better, and not spend a lot of time worrying about, well, what's it going to be like 3 months from now? because there are 90 days between today and 3 months from now. And every one of those days is going to have its own ups and downs and unique challenges. And you sort of need to focus all your energy on just getting through whatever those are on a daily basis. And I'm sure, you experienced all this in your own care and treatment. So none of this is earth-shattering news to you, but it's just, trying to be present and trying to just get through every day. And by God, some days the next day was better.
Yeah, absolutely. And what about you, doctor?
I think it's, I said this before about having a team to support and take care of patients who are undergoing bladder removal and having chemotherapy, because again, these surgeries are complex and patients need to understand, what's going to happen at the road ahead of them. I wish I could tell you that, don't worry, it was going to be great and easy. And it's one of the reasons why I wanted Lee to tell his story, because there are other bladder cancer patients out there like him. And they will ask me, does this happen to other patients? Yes, it does. We know it does. And we're trying to make the surgery, the system better. And one of the ways to do that is to have all of the doctors so that I can provide Lee all the things that he needs at a moment's notice. And all my patients, have direct access to me. He would see me every week in the clinic. He would hate to text me sometimes because he knew what I was going to say. Come into the ER. I don't want to go into the ER. I need you to go into the ER right now before this gets bad. And he would do everything I said, whether he liked it or not. And he had such a hard time with COVID. That was just rough to have a big surgery, be sick, and not have your family. But one of my fondest memories was when Talis and the boys came and they had the big sign outside St. John's, and we were like looking out the window, waving at them. Was that your birthday?
No, but they had signs and balloons, and it was really heartwarming.
It was very, very heartwarming. And she's like, okay, you have to take him over to the window so he can see everything. So it was very nice. But I mean, that was just so rough on patients.
Yeah.
I mean, the only human interaction he would have sometimes was me or the other doctors and maybe the nurses who were running in and out of the rooms, and everyone was afraid of getting everyone sick. So, I mean, you had a lot of challenges, and you're my hero.
Thank you.
Well, thank you both so much for being here. Like I said at the beginning of the show, this is the first time that we've really done, the patient and the doctor. And it's such a difficult topic, but you guys made it so warm and just informative to our listeners and our viewers. So thank you both for being here. We really appreciate it.
Thanks.
Thank you.
Yeah, we want to thank St. John's Health Center Foundation for making this podcast possible. Thank you all for joining us today. And please send us your health questions to yourhealthydosepodcast@gmail.com. And doctors like Dr. Linehan and so many others will be able to help us answer those for you. So until next time, I'm Kim Douglas with Your Healthy Dose.